Hi, I'm Dr. Fern White. Why do we, or you, have to come every 6 months or more for your active maintenance hygiene appointment and check? So think about this. If you bought the most expensive equipment, say it was a car and it was German made and it was the bee's knees, it cost you tens and tens of thousands of dollars, and you use this car every single day, 365 days a year, 15 hours a day, all the time, and you never serviced it. Would that car even last you a year? Okay, so back to our teeth and gums and bone. We expect these guys to keep doing work for us day in, day out, and they just keep going. It's incredible. So what happens when you don't maintain them? And this is from a gum perspective only. Forget about the teeth, because a whole bunch of things can happen. Little cracks can start happening without you even knowing it until one day, bang, you get pain. And a whole cascade of things happen in our body, and our body really tries to heal things before you get a warning sign of pain. So pain is often too late. It's a sign that things have been going on for some time before so much destruction has already taken place. So your teeth are surrounded by a foundation, the gum and the bone, the jawbone underneath, and these hold the teeth in place. So what happens underneath this area that you can't see? On the top you can see, you can clean, but what happens over time is that bacteria build up in the form of what you call tartar or calculus and plaque, and it becomes concreted underneath the gums. So have you ever gone to the beach and you've gone on the jetty and you had a look out there and there's beautiful water and there's the stumping of the jetty that you're standing on? And an hour later the tide goes out and suddenly you see underneath where that water was is all this gunk. Well, imagine that gunk if you had a microscope in your mouth and you shone it underneath the gum line and you hadn't been for maintenance for a long time. It's concreted with billions and billions of bugs, bacteria. And what do? Well, over time what happens is that the bugs, if they're left there long enough, you can't clean or floss them out anymore because it's way too hard, it's fully concreted in. And what happens is that the bugs then start to multiply and eventually destroy the bone, your jawbone that's holding the teeth. And this process happens for a long time, and your body is constantly trying to fight these bugs, but it can't because they're hidden, they're concreted in this plaque and tartar. And eventually the jawbone starts to go, and one day you come back 10 years down the track, and that's happening. And guess what happens to the teeth now? Bang, you have to remove it. And even trying to replace them these days with implants is a hard feat because you need bone to put all of this stuff in. But that's the long story. The short story of it is all these bugs, okay, what they start to do is they start to go through the gum into your bloodstream and infiltrate your body. We all know now that gum and bone disease in the mouth is linked to systemic disease or inflammation in the body, and it's linked to things like heart disease, osteoporosis, diabetes. In fact, I had a patient who's a doctor from ICU come in and tell me recently that one of his patients who is in ICU, an intensive care unit, is in a coma because he's got a heart abscess or a heart disease that the bacteria had been tracked back to a dental abscess, okay, that was from the gum. So it's pretty serious business, and our body will give us little warning signs that something is amiss. So you might get a little bit of gum bleeding, and people think gum bleeding is okay because it doesn't hurt. But if you bled anywhere else on your body, say you cut yourself and it went red and you could see it and it didn't hurt, but it stayed swollen and red for such a long time, everyone would actually go and see the doctor. So in the mouth, lots of things actually don't hurt in the mouth, but the body is so intuitive, it gives us warning signs, and bleeding gums is one of them. Look out for that. If you're a smoker, you're not going to get many warning signs. It's actually all camouflage, which is even worse. So bleeding signs, bad breath, so many things are going on in there and they need to be checked out. If they don't, you're at risk of all of these things and you don't even realize. So there's a lot of damage that can be happening already without you realizing. And we know some of the diseases that happen without us even realizing in our body, like cancers. So get yourself protected. Come for your regular hygiene appointments regularly, and we'll check out your gum and bone, and we'll check out your teeth separately.